My name is Demetrice Moore. I'm a firefighter. I'm 41 years old. I have a wife and 3 children. I love playing with my kids and doing different activities with my family as a whole.
Well, after school, my kids come home and they're now learning how to cook, so they usually cook grilled cheese sandwiches for snack.
I was having some trouble breathing. I thought I was having an allergic reaction. 2 weeks after being treated at the local hospital, the symptoms returned and they were more severe. A physician advised me to go to the closest ER at that time was DeKalb Medical.
Mr. Moore came to our ER complaining of trouble swallowing. He couldn't eat. He had a sore throat. He was just miserable.
When he would lie flat, the acid would wash back up into his throat. He was losing weight. He, wasn't able to work because of lack of sleep and just general discomfort from his terrible reflux.
He had never been sick. We've been married 16 years and never any problem and never any health issues.
Mr. Moore was referred to the Heartburn Solution Center. He still felt like he had some unresolved issues and needed some further help.
Not knowing was very confusing for us, but I was glad that we continued to communicate with the doctors.
And finally they were able to determine that I had an underlying illness that had been dormant for years.
When he was diagnosed with GERD, I was shocked. I didn't know because there were never any symptoms of it or any signs.
GERD stands for Gastro-Esophageal Reflux Disease.
The physician at DeKalb Medical Center advised that I start out with a drug treatment program, and none of the drug treatments worked. They decided that my condition was severe enough for me to consider surgery.
We determined that there were 2 possible surgical options for him. The first surgical option would be the standard procedure, which involves wrapping your stomach around itself and the lower esophagus. And the second procedure is something called the LINX procedure, simply placing a magnetic bracelet around the lower esophagus. When the magnets attach to themselves, it increases the pressure and prevents the acid from coming back up into the esophagus.
We went into his office. He showed us the LINX, how it would be placed, and we said, let's go for it.
The LINX surgery was ideal for me at my age and activity level.
I was nervous about it, but we spoke with the doctor over at DeKalb Medical, and he assured us that this was the best solution.
Mr. Moore was the perfect patient. He had great anatomy, the bracelet went in easily, and his reflux resolved in the recovery room.
I didn't have any surprises post-surgery because after I spoke with Dr. Steinberg and Pam, they advised me of what side effects might be possible.
One of the strengths of the Heartburn Solution Center at DeKalb Medical is that we're very accessible. Pam, our nurse coordinator, and I are always available to speak with our patients before and after their surgery.
They took a lot of time and answered questions, and they made sure that they were there for you to kind of educate you about the situation.
It's a wonderful feeling treating someone like Mr. Moore. After he woke up without any more heartburn, I knew he was going to be happy.
The personalized care that I received at the DeKalb Medical Heartburn Solution Center really surpassed my expectations in every way.
One of the most amazing things is watching people like Mr. Moore go through our testing and go through our center and get such great satisfaction.
What I'm looking forward to is just being able to have a normal life and to see my kids grow and have healthy, productive lives themselves.
We can go out now and play basketball together as a family, as exercise after school when the kids come in, and we have a good time, so we're happy.
I owe a lot of thanks to DeKalb Medical Heartburn Solution Center, Dr. Steinberg, Dr. Sharma, and Pam, and all the other nursing staff there who really helped me get a new lease on life.